first session of the programme called Impulsive Lifestyle Counselling. My name's Ellen. What's your name?
I'm Klaus.
Nice to meet you, Klaus. I work as an intern here at the Centre for Drug and Alcohol Research. I've been working with people who have problems with impulses for the last year or so and have learned about impulsive lifestyle counselling so I can guide these sessions. However, this is my first session, so I'll be reading mostly from the manual if that's okay with you.
Go ahead.
Okay. So how are you feeling today?
I'm okay.
Mm-hmm. And how do you feel about talking with me today?
It's kind of curious to see what it is.
Okay, that's good. You've decided to participate in the Impulsive Lifestyle Counselling programme. You've probably already heard a bit about what the programme is about, but I'd like to tell you briefly about the objective of this programme. In the Impulsive Lifestyle Counselling programme, we will talk about what you can do when you have problems with impulsive thinking and behaviours. We think that if you can better understand your impulsive lifestyle, there will be a better chance that you will experience fewer problems in your life. This could be, for example, problems with drugs, family, friends and crime. It can also be problems with completing things that are important to you, or problems with trying to take shortcuts that end up becoming annoying detours. There are 6 sessions in Impulsive Lifestyle Counselling. Each session lasts for about 1 hour, and the first 5 sessions take place once a week over the next 5 weeks, and then there is a follow-up session 6 weeks later. In order for you to get the most out of the programme, it's important that we both try to work within this framework. Of course, unexpected things may happen, such as illness, which means that we may have to postpone one of the sessions, and then we would have to try to set up a new appointment as soon as possible. Do you have any questions?
Yeah, what if I need to see my social worker or something?
That's absolutely fine. We can rearrange a new appointment.
Okay.
So first we're going to talk about the dreams that you have in your life. The reason for this is because people's dreams are important and what you dream of is what drives you. Even though some dreams cannot always be realised, they show something about what is important to you. So please can you tell me 2 things that you've dreamed of in your life or that you're still dreaming of now, and it doesn't matter if they're realistic or not.
Yeah, when I was a kid, I used to want to be in the special forces, like being a soldier,
Mm-hmm.
but then I got into prison and that went down the drain, and actually I've thought about becoming a psychologist.
Oh, okay.
So I think I could be a pretty good therapist.
Okay. Can you tell me why being a psychologist is a valuable dream to have?
I've seen so many horrible counselors and therapists, and I think I could do a lot better than a lot of those people. I think I could really help people,
Okay.
could understand where they're coming from, especially young people who are getting into trouble with drugs or alcohol. I think I could really be a good therapist for them.
Okay. I've just taken some notes saying that the reason why you'd want to be a psychologist is that you think you could do a better job than current professionals because you have an idea of what these people maybe have gone through.
Oh, yes,
is that correct?
Yes, absolutely.
Okay.
And I find that many young people look up to me,
Yeah. So you get respect from younger
yes.
people. Okay. That's good. Is there anything else you want to add to this one before we move on?
No, I'm fine.
Okay. So is there a second dream that maybe you could tell me about?
Well, I also thought about having a family of my own.
Family. Okay. And why particularly is that an important dream to you, being a family man?
I think that's important, being a man, that you have your family around you and everybody respects you, and
Okay. So gaining respect again.
Yeah.
Okay.
respect is a big issue with me.
So very important. Okay. Again, is there anything more you want to add before we move on?
No.
Okay, that's fine. So now let's talk about why it's important to work on changing an impulsive lifestyle. Before I explain the objective of this programme, I'd like to hear some of your ideas. So why do you think it's important to work with your impulsive lifestyle?
Well, I think it's mostly about the drugs.
Okay.
I think most of my impulsive decisions are either you have the urges, or you get an opportunity to take some drugs, and bang, you just do it without thinking too much about it, or when you're high, you don't think things through and get angry, you get upset, whatever, you just react, end up in a fight, stealing some things.
Oh, okay. So taking drugs and getting high can trigger some negative emotions that are themselves quite impulsive, would you say?
Yeah, or you just do something without thinking.
Yeah. Okay. So these two thoughts and actions. Okay, are you happy to move on?
Yeah, sure.
So I've got a handout here that tells you about the objectives of the Impulsive Lifestyle Counselling program. By becoming aware of your impulsive ways of thinking and acting, you will be able to address your impulsive lifestyle and how that can create problems for you and how you can work on changing it. So we'll go through this together. So the objective of Impulsive Lifestyle Counselling is to help you identify the behaviours that get you into trouble with drugs, alcohol, other people and the law, and help you decide if you want to change your behaviours so that you can get less into trouble.
Yeah, I can relate to that. That's just me.
Yeah. Getting into trouble.
Yeah.
Okay.
Especially with the law, the police are on my back. When I was young, I did just one mistake and I get into trouble all the time now because they're just on my back.
Oh, okay. Well,
even if I haven't done anything, they'll just be there all over me.
I see. So now we're going to work on 4 areas that are important for people who usually have trouble with impulsive actions. I'd like you to tell me if you can recognise yourself in any of these areas and maybe come up with some examples from your daily life. Okay? So the first of the 4 areas is self-indulgence, which is acting to meet your own needs without any sort of moderation. So this could be drug abuse or gambling, or possibly getting impatient or aggressive when you have to wait your turn, like in a line at a supermarket or when you're waiting for medicine. Can you see any crossovers with your own life in this area?
I hate waiting in line. People that are just slow and they're just chatting up the nurse, the medication pickup, or in the supermarket, I can go crazy over that. Other than that, yeah. I don't think I think of myself. I think a lot about other people, what they need. I think I care a lot about people.
Okay.
Especially people who are weak or vulnerable, who are being abused by others. I think a lot about them.
Okay. So moving on to the second of the 4 areas, there's breaking rules. So breaking the rules of conduct or law breaking the rules of conduct or law in a given environment. So harming other people or offending others, or not following common social rules, or criminal violations. Can you see any examples from your own life?
Sure, but mostly when rules are just stupid.
Okay.
If people set up rules to basically to show that they are in charge, like smoking rules, you can everywhere you're not allowed to smoke today. Back in the day, you would respect other people instead. You wouldn't smoke if there was somebody around who didn't like it. But today it's just rules. And sometimes I get so fed up with all these rules.
Okay.
So yeah, but I don't think I break the rules just to break the rules.
Okay. The third of the 4 areas is interpersonal intrusiveness. So that is acting in a way that does not respect the rights of others, so possibly injuring or offending others, or maybe taking advantage of others, such as your friends or your family, or even threatening them with a weapon. Can you see any examples from your life?
I mean, I could end up in a situation where I threaten someone, but normally I respect people.
Okay.
I'm a very respectful person. And I respect the rights of others. Like I expect them to respect me, and I respect them.
Okay, I see.
So unless people have it coming, I would never threaten someone. I would never attack someone.
Okay, I understand.
Sure.
The last area is irresponsibility. So that is failing to keep your commitments to yourself and others in a socially acceptable way. So perhaps maybe not paying child support or attending your appointments or not being a responsible employee by, turning up to your job regularly.
Maybe I'm irresponsible with myself
Okay.
because I keep up ending in situations where I don't have any money. I lost my apartment at one point. I've lost a lot of jobs.
Mm-hmm.
So yeah, maybe there's something to that.
Okay. So in the first part of this session, we've been talking about your dreams and the 4 areas that people often have trouble with when they have an impulsive lifestyle. In the last part of this session, we're going to talk about the goals that you can have for yourself and your life. Goals like this are important because they influence our thinking and behaviour and the way that we plan our lives. So first of all, I'd like to ask you to give me some examples of goals you'd like to set for yourself. So try to make them specific, clear and realistic. And by this I mean specific being time bound, so it could be next week, it could be next year. Clear means that it's well defined, you're not ambiguous about what you mean. And realistic, it's something sensible, not flying to the moon.
Okay.
Does that make sense?
Yeah, sure.
Okay. So, can you think of any goals straight away that you could work on?
Well, I have a really bad toothache,
Okay.
and I'd like to get that fixed, for sure.
Okay.
But I don't have the money to do it.
Okay. Is there a way that you could possibly get some money in order to go see your dentist?
Well, it's always a way to get money, but it's, once you do something to get money, if I do something, the only way I know right now is to do something criminal, and I'll get involved with people I shouldn't get involved with, and I'll
Okay.
have money in my hand that I could use for drugs.
Okay.
But, so maybe the best way, which is also a slow way, is to go and see a social worker and
Okay.
get approved that the social services will pay for my dentist, and then I have to go to the dentist, and they have to tell me how much it costs, and then I have to go back to the social worker, and it's
Okay.
back and forth, but it can be done,
Okay.
I guess.
So that would possibly be a better solution then, is to see or speak to your social worker first. That sounds like
Yes.
a better way to go. So could you maybe pick a time, maybe? Like when do you think you could get this done? Starting with speaking
Well,
with your social worker.
It hurts,
Okay, so it's quite important.
so it's kind of urgent, yes.
Yeah, okay.
I can't really think, I actually have a hard time sitting here thinking about it.
Okay.
Yeah, I could get it done next week, I guess.
Okay.
If I can get it to pick up the phone, that is.
Yeah.
Yeah.
Okay. So that's one goal of getting your toothache fixed and
Yeah.
speaking to your social worker first about being able to pay for your dentistry. Okay. Are there any other sort of intermediate goals possibly that could be done on the side as well?
I don't know. At some point I'd like to go to inpatient rehab, but not now.
Okay. So I can write that down, but it's not something you're wanting to do just yet.
No.
Okay. Rehab, but not just yet. Okay. Are there any other possible intermediate goals you can think of?
No.
Okay.
Not at the moment.
So would you like to move on to the next
Yeah.
part of the session?
Sure.
Okay. So today we've talked about the goals that we have for our lives and the behaviours and attitudes that are related to an impulsive lifestyle. I've also got some homework for you to do for the next session. So it's much of the same of you can take this paper away with you and think about goals, but it'll give you a better sense of how you can work towards the goals you've set for yourself and how they can improve your life. But if you don't get it done, we can speak about it the next session. But it would be quite nice if you maybe took it away and thought about it.
Okay. I'm not good with homework. You can ask all my teachers through school about that.
Okay, that's fine. In the Impulsive Lifestyle Counselling programme, doing the homework is important. It supports us as we work on making positive changes in our lives in between these sessions. The effort to make changes in your lifestyle happens as you are living your life, not just while we're sitting here having a conversation.
Well, I guess that's true.
Yeah, okay. Now that we've come to the end of the session, I was wondering if you'd maybe like to think about when we can have our next appointment.
Yeah. Next week, same time. It's okay.
Okay, so that'd be Monday at 12.
Fine.
Okay, that's no problem. And you can take this with you. I'll see you next week.